Hi, I'm Alana Hippensteel from Pharmacy Times. Before we get started, one of our top articles today discusses the critical role that pharmacists play in managing changes to HIV care during the COVID-19 pandemic. There's more of that on pharmacytimes.com. Today, I'm speaking with Nancy Lyons, the Vice President and Chief Pharmacy Officer for HealthMart, and Pete Sloan, the SVP of Public Affairs for McKesson, on the value of the pharmacist and the reasons why provider status for pharmacists may be an important issue to consider. So Nancy, what has been the value of the pharmacist in the past, and has that value changed in the eyes of the public during the COVID-19 pandemic?
Alana, that's a fantastic question. Pharmacists have always provided value and solutions for their patients as they leverage their skills, their training, and expertise. This value has been documented over decades with positive impacts on medication adherence, chronic condition management, wellness solutions, and of course, dramatic improvements in immunization rates since pharmacists were given the ability to do that. Accessibility has always been a huge factor in the impact that pharmacists can make, especially in the independent pharmacies that are part of the HealthMart family. Many of our HealthMart pharmacies are located in rural and underserved communities where the pharmacy may be the only healthcare source for several miles. With all of that past success, I think the biggest changes during the COVID-19 pandemic are in the increased public awareness of all that pharmacists are capable of doing. The awareness started in the communities where they saw their pharmacists as those essential workers step up to keep their pharmacies open and offer curbside and drive-through services, and just to provide that calm when the initial panic, when the shelter-in-place orders were issued. And then they continue to step up with PPE donations, compounded hand sanitizer, and COVID-19 test collection sites. The awareness has increased even more with the multiple declarations that the United States Department of Health and Human Services have made over the past several months, calling out pharmacists specifically for COVID testing, childhood immunization catch-ups, and COVID vaccine administration.
Yeah, absolutely, absolutely. Pete, what would you say is the role of pharmacists in our healthcare system in light of pharmacists' expanded importance in the fight against COVID-19?
So all that Nancy just described is really important to step back and appreciate how quickly change has been effectuated as a result of COVID-19.
Right.
In thinking about a global health pandemic, there are no silver linings to be had. But when we reflect on how long it has taken us to make the case for state or federal legislated change of the variety Nancy described, and that is still languishing were it not for the declaration of a public health emergency and the HHS declarations, we would still be treading water on some of these really clinical provider status issues. I bring somewhat of a personal lens to this as a son of pharmacy. My dad and his two brothers owned and operated Sloan's Pharmacy, only job my dad had for 15 years. And as for many that have worked in a family pharmacy business, I did every menial job that you can expect from age 9 forward, including dusting the shelves, ringing the register, sweeping the floors, but also unpacking the McKesson truck every day.
Right.
And so I have this long historical arc through which to view the progression of the role of pharmacy in the provision of essential services, diagnostic, clinical, and other disease management services in local communities, particularly those, as Nancy mentioned, that are very hard to penetrate, medically underserved in rural areas, in particular where the primacy of the pharmacist relationship with the patient is unique and perhaps the best pathway to provision of care and monitoring of the patient. And I think there is absolutely a growing recognition of the important role of pharmacy in the healthcare ecosystem writ large. And pharmacy will absolutely be a very significant venue for administration of forthcoming COVID vaccines.
Yeah.
And if you think of how long it has taken for us to do that legislatively and through regular order. This is a breakthrough, but imperative we do two things as a community. One, that we gather the empirical data that validates the public policy case we've been making for years, that pharmacists providing these services is every bit as safe and efficacious as in many of the traditional sites of administration. And two, that we begin now thinking about how we're going to port those learnings and extend the policy beyond the public health emergency declarations, which are not going to be in place all that much longer. So in our zeal to do the work, we have to remember all of which is required to extend this, to perpetuate this, and have it be a springboard for additional clinical services that would be reimbursed under the medical benefit.
Yeah, absolutely. Nancy, how could giving pharmacists provider status benefit the healthcare system during the COVID-19 pandemic?
I think I'm going to have a simple answer for that one. And that answer is that provider status simplifies the billing and payment processes for the services that are performed by the pharmacist. And that just removes the barriers for the patients.
Right.
If the pharmacist is the right provider and it's an accessibility issue that they can go there, they shouldn't have to decide whether or not they need to pay out of pocket, or if the pharmacist is going to, be disadvantaged for providing that service.
Yeah.
And Pete just said it a few minutes ago, but with all the action that HHS has taken to grant the authority to pharmacists to help solve those critical health needs, the payment and reimbursement issues are often what stalls the process and slows down the good work that all of us are trying to accomplish for the nation.
Right. Yeah, absolutely.
And I'd only add to what Nancy said. For the first time, the federal government has taken a deep dive on pharmacy economics and come to understand what does it take to do specimen collection for COVID testing?
Yeah.
What is required to do vaccine administration down to a very granular level, and understand that some of what was feared in the past in terms of upsetting the apple cart with provision of like-kind services in a physician office or alternative site of care where reimbursement is already in place, it is not a problem at all. And in fact, savings could be realized, penetration would be greater, and that of course means greater patient access, and perhaps consistency in monitoring of those patients for side effects, or in the case of vaccines where there may be a second booster shot required, tracking all of that. The other thing I'd say is, when we were trying to make the case for federal legislation, the price tag that was set by the Congressional Budget Office was, we thought, terribly outsized, and the actuarial model that they were using, terribly misinformed. And fighting that battle was proving exceedingly difficult. What HHS accomplished for us on short order with our community's significant input, it has taken all of those issues off the boards, and we need to keep it that way. And reassure that through collaborative practice agreements and other mechanisms, that the kinds of services we're talking about aren't being done entirely in isolation. And organized medicine is not being cut out. In fact, this is enhancing the collective provision of healthcare in communities where it counts.
Right. So, Pete, do you think that giving provider status to pharmacists could more broadly benefit the healthcare system, not only now, but also on into the future? I feel like you've answered that somewhat, but if you have any further expansion to that.
Well, my own view, and then I'll let Nancy, the real expert, go, is there's a growing recognition at a time when we've got a looming primary care shortage. We have a public health epidemic of a generation, and a looming significant gap, as Nancy mentioned, in the number of children that are being immunized and adults that are receiving their seasonal flu vaccines, and the potential of a second wave of COVID or return of H1N1. All of that and then some is a perfect storm.
Yeah.
And it really compels us to think about breaking old paradigms and models. And with that, I think there is extraordinary new opportunity for pharmacy that's not being questioned in a parochial way from some quarters as it has been so often in the past.
Yeah, yeah, absolutely.
And I guess just to kind of tag on to what Pete said there, not only do we have the benefits to the healthcare system, but we definitely have a pipeline of really well-trained pharmacists that are ready to make that change and make that benefit to the to serving for their profession.
Yeah. Yeah.
And if the upshot of all that is that we're getting to more patients more efficiently and at lower cost, that makes the case, I think, for sustainable policy change.
Yeah, absolutely. On that point around policy, Nancy, in your mind, what are some legislative priorities that would support pharmacists in delivering the greatest value to patients this year?
Sure. Well, we've already talked about some of them, and I think it's actually the title of this session. Pharmacists need to get provider status wrapped up. It's been my entire career that we've been waiting for this, so I'd love to have that little check mark there. We also need the action that Pete called out earlier on those emergency declarations, making them not expire. But some key priorities on the way to those, I guess, are solidifying that COVID-19 vaccine response to make sure that the plans that have the barriers removed, honestly, for all healthcare practitioners that are going to be involved, but including pharmacists the same as they would any other healthcare professional. Renewing the focus on important public health programs such as Ready, Set, Prep that has been disrupted by the pandemic. You know, we've put aside some of the other really serious health concerns that we need to get back to make sure that the overall health of our nation isn't forever tarnished by COVID-19. And then just expanding resources and pharmacists' abilities to impact chronic conditions. We saw during the pandemic a disproportionate effect of the virus on those who maybe weren't controlled. And we know that pharmacists can have an impact on conditions like diabetes and getting them managed. So we need to work on that. And then the last is reforming the DIR processes to make sure, again, that those, especially those independent community pharmacies that are in those already underserved areas, don't just go away. So COVID is important. Living since COVID is going to matter for the rest of our lifetimes, but not losing focus on the things that were issues before COVID.
Yeah, absolutely. So Pete, do you think these legislative priorities Nancy mentioned will change following the end of the COVID-19 pandemic?
So we're in a tumultuous political time. The administration recently announced 4 executive orders on drug pricing and transparency. There are some indirect implications for the practice of pharmacy potentially. And there are no doubt more to come. And we have the potential, we're all doing contingency planning in the event there's a change of administrations and if a new president were to have a majorityship in both chambers of the Congress, that it undoubtedly changes the agenda. I think what's clear, though, is even were it to be the case that Joe Biden becomes president, their overwhelming focus is going to be on COVID response and on getting the economy back onto stable footing. Having said that, we believe that the pharmacy community needs to do a little bit of a pivot. Everything we've been talking about in terms of the emergency declarations and providing newfound authority and appropriate reimbursement for pharmacists provided clinical services is bespeaks a shift in focus, at least now, wherein the executive branch has effectively preempted the legislative branch and done so at lightning speed and in really meaningful ways. And thinking about how we sustain that in either a second Trump term or in a Biden administration, but more executive branch focus than we've ever had. And then secondly, not forgetting the states. We've been talking all about federal policy here. And yet the nexus of activity really has largely shifted to the states. And some of what we're talking about was included in governor emergency declarations first, or already enacted in state law. And when we think about what's still pending when we get back to something like regular order, the states, there's, we believe 40 states are already considering some legislation elevating pharmacists' scope of practice and clinical services. Additional legislation focuses on the other half of that equation that makes it sing, which is reimbursement for those services under medical plans. And then secondly, PBM reform, where I think there's going to be a lot of legislative activity in the context of the drug pricing and transparency debate, but as well as pharmacy gag orders, the degree to which there's some residual of that out there. Regulating the process by which PBMs conduct audits of pharmacies, adjudicating claims or clawing back monies that have already been paid, establishing MAC pricing transparency or an appeals process, and requiring PBMs to disclose more relative to cost, rebates, reimbursement. And then all of the issues that we're seeing at the federal and state level around providing manufacturer rebates, discounts, more transparency around them at the point of sale and in a manner that benefits our patients, our consumers. So a lot of states are looking at legislation that would prohibit PBMs from steering patients, spread pricing, and then a spate of issues around 340B, drug discount covered entities, and whether they should be treated any differently than contract pharmacies. So that's just a quick slice, but I want to remind everybody that we have this pivot to the executive branch, and we have the states that can move much more quickly and have a lot on the docket already.
Yeah, absolutely, absolutely. Thank you so much for taking the time to speak with me today, Nancy and Pete. Now let's hear from some of our other MJH Life Sciences brands on their latest headlines.